Welcome to Life Happens, where Texans come to protect their legacy and prepare for the second half of life. Join your host, attorney Kim Hegwood of Your Legacy Legal Care, and our weekly guest as we navigate the challenges that emerge as life happens. Now here's your host, Kim Hegwood.
Good morning and welcome to Life Happens with me, Kim Hegwood, and our very special guest today is Dr. Jean Sadowsky. And so good morning.
Morning.
So today we're going to talk about a really important topic, and we're going to talk about oral health and how important it is, when you become a senior, and so as you age. And I so appreciate you being on the show today. And so just wanted to thank you ahead of time. And so let's kind of jump in and let's talk about, why is oral health important in the elderly?
Well, it's the key to total overall health. Almost all diseases are either represented in the oral cavity or we have issues in the oral cavity from that disease. So they used to have there was a lecturer that I had in dental school, and he would say, tongues I have known, because the tongue, you can tell a lot of diseases just looking at the tongue. And usually physicians, they look past the tongue, down in the throat. They go past the whole mouth. So it's really the major part of the body, the gateway to the health of your body.
So just out of curiosity, what kind of things when you're looking at the tongue do you see that in elderly that
Okay, the main thing is dry mouth. Whenever they take certain medications that dry up their mouth, dry up their eyes, whenever their tongue is sticking out, it's pebbly and it's dry, and they have a hard time talking, eating. It's really a disaster because of medications that many of them take. That there's over 500 medications that cause dry mouth. So if you have it, you know it, and it's a horrible thing. It's like eating a bagel with a crunchy peanut butter on it, and then the casting sugar on top. So you can't chew it. It's dry. It doesn't. There's no moisture. It's devastating.
I was like, that just sounds horrible. I mean, it truly does. I'm like, there's a visual that you never want, right? And so
Yeah, and like I would say, over 50% of the elders have that.
oh wow.
Yeah,
That's a high number.
it is. It is.
And so is there any other particular things that you look for when besides dry mouth that really trigger things?
Well, bleeding gums. Whenever you brush and your gums bleed, that's a sign of periodontal issues, periodontal disease. And so you need to really be active in the dental. Go to your dentist to find out why is your gums bleeding, because that's not normal. The more you brush, the healthier your gums are, if you're using the right technique, and of course using a soft brush, that sort of thing. I'm qualifying it then.
Well, my dentist sees me 3 times a year, so he's very happy.
Well, your gums are probably very happy too.
Yes, since I did that, they're actually, a whole lot better too.
Yes.
So.
And you know that prevention is much more cost effective than having to have a periodontal surgery or having a tooth out because it's loose and you didn't go to the dentist. So prevention is the key.
Yes, I'm with you there, and so most definitely. So let's kind of switch gears for a minute, and let's talk about is there a connection between oral health and cognitive issues that seniors are facing?
Yes. One thing that I just was reading last week is that they have found the periodontal bacteria that live in the periodontal issues in your brain after death. So it means that that bacteria is able to travel if you have periodontal disease. So when you have cognitive issues, you don't want to brush, and you don't brush, and you sometimes you're even get agitated. You won't let anyone get near you. So it's better to get that started earlier before the progression of. We know that cognitive issues progress until you're fetal position, so to speak. But if you have teeth, they need to be brushed. And if the person can't brush them, we really need to find some loved one or a caregiver that can brush them and help them brush.
So well, that's shocking to think that, something having to do with your teeth, is, uh, affect your brain as well. And
Yeah.
so,
Yeah. Well, so far as having periodontal disease, if you have periodontal disease and uh, say diabetes, the periodontal disease makes the diabetes much worse. And they found actual research has been done, and they find that if they clean their teeth every 3 months, it lowers the A1C. So you can have a better diabetes outlook if you have periodontal taken care of. So that is very interesting. Also on uh, rheumatoid arthritis. If you have arthritis and periodontal disease, it crosses it. It's worse. It makes the periodontal disease worse because of the inflammation in your joints and the inflammation in your mouth. The inflammation is what attacks the rest of your body. And we found that inflammation is carried in the bloodstream and on the nerves, and that's how it gets in the brain. But that's how it can affect the heart and increase heart disease. So it's all having that chronic inflammation of that bacteria around your teeth.
okay, well, I have to tell you, I have been, I didn't think I didn't think I could be shocked anymore, but I am today. And so,
Well, I,
uh, it's like, wow, I had no idea. So, now I'm like even more excited that you're on my show today. But I know from personal experience that the dental work can be expensive. And so what can seniors do to help kind of defray some of that cost, of taking care of their teeth?
well, they defray their cost if they wish to be treated by a dental student, of which I'm a faculty and I supervise the students, and we have faculty here that supervise. The cost is one half to one third less than what it is. Plus, if you need specialty work, we have specialty students that are already dentists that are learning to be endodontist or periodontist, or whatever specialty you can think of, we teach that. And so that is probably around maybe a half, maybe three quarters of what it is out in the city. So that is one thing that they can do. Also, just going and having an evaluation is to actually invest, because your teeth are the most valuable things you have. They really are more valuable than anything. You can lose a hand and you can still survive, but it's hard to eat if you don't have teeth. It affects you in social. You can't be socialized. So there's so many factors that people think, oh, your teeth. Oh, so what if I lose one? I have 32 or whatever. But that really isn't true. If you end up like a jack-o'-lantern where your teeth don't meet, you can't even chew your food, and that leads to all the gastric issues because you can't digest the food. So it's really important to go be checked out. Then you can say, okay, I've checked out. I know I have this, this, and this, and I can plan to take care of it or get a second opinion. I mean, we're all happy to give second opinions without recourse, so to speak. And I think that that's a very good idea to do. And I think that talk seniors usually have loved ones. Loved ones want you to be able to eat. They want you to smile. They want you to be happy. And I feel like that I took care of my mom, but I was in dental school at the time and took care of her dental needs. But there is your family wants you to be happy, and I think they would sacrifice even to help you do that.
Oh, I think so. Most families, absolutely. And
Yeah.
so, but how can family members help someone that has dementia? Because I know that's a lot harder to get someone to brush their teeth.
Exactly. Well, what we do is we train people in facilities to brush their teeth. The key to brushing someone's teeth that has dementia is that bond of trust. If some stranger comes up to even you or me and tries to brush our teeth, we're not going to be happy about it. So, but if my loved one, my daughter or my granddaughter, gives me a hug and is able to kiss me, I know that I would let them brush my teeth because it would be a loving situation. And so I recommend that all facilities use one person to do that so that they can form a bond of trust with each of their clients or residents or patients or whatever you want to call them. I know that nowadays everybody's saying that nobody wants to be called older. They want to be called elder or senior or whatever. There's so many acronyms now.
Yeah, and so I just want to be called young. So just so you know, be be
Okay,
called young.
I'll remember
Uh,
that.
there you go. And so, so let's talk about UT Health Dentistry program. So how can it help seniors, take care of their teeth better?
Well, we have, like we say, come in for an evaluation and assessment, and they would decide how you help. Also, we go to many clinics. I had the list around here a while ago. We have many clinics that are low cost, like San Jose Clinic, that our students go and treat people. And there are out in uh, like the Woodlands and over to the right. I can't think of the city over there, the town, but there's a clinic over there. I don't go to those clinics, so I don't know that. I don't know exactly their names. I know it's called Tamagua, and that's all I know, and that means the it's an acronym, and I'm not good with those. But we have them all over town. We have them in the north, we have them in the west, we have them in the south, and we have them in the east. So we pretty much take care of have clinics everywhere. And if you want me to, I could email you that so you could show it on your show or have it available, or they could contact me and I could send it to them. It doesn't matter,
Yeah,
where the clinics are. That
yeah,
that
I'd love to have that as a resource. So we have
okay.
a huge
Good.
resource library. So I'd love to have that as a resource
Okay.
as well.
Okay. I will get that out probably to Catherine. Is that all right?
That's perfect. And
Okay.
so Dr. Sadowsky, if someone wants to get in touch with y'all, how do they do that?
Well, we have a main number that they can call. It's 1-800. It's 713-486-4000. See, mine's 4064, but 4000 is the general number. I don't know how easy it is to get through there. This is a institution, so sometimes they only take calls on the Monday morning, and then when they fill up, they don't answer anymore. You know how it is in the health science center. It's kind of hard, but they can keep calling that number because eventually, and they have prompts. So if you want just your teeth cleaned, we have a dental hygiene program where the cost of getting your teeth cleaned is very inexpensive, but you have to qualify, meaning that you have to have the right amount of problem in your mouth, meaning you have to have bleeding gums, you have to have something that they need, because basically we're not here to give out free dentistry. We're here to teach students. And so basically we want them to learn to clean all kinds of mouths. So we want them. So if they don't need that, then you would not be you couldn't come in, have it done. But you could go to one of those other clinics because I don't think they have that requirement for the students.
Perfect. And so, all right, Dr. Sadowski, thanks so much for being on the show today. I have learned a lot. And
Well,
so,
you can have me on again and we can talk about something else, something
well,
more, because I haven't even gotten half through what I was going to talk about.
well, we will definitely do that. And
Okay.
so, all
So
right, thanks so much.
thank you.
Thanks for tuning in to this week's episode of Life Happens with Kim Hegwood. Be sure to tune in every Thursday at 10 a.m. wherever you listen to your podcast as we navigate through the challenges that emerge as life happens. The content of this podcast does not establish an attorney-client relationship or constitute attorney-client privilege, legal, medical, financial, or any other professional advice.